And welcome to this Anatomy Quickie, an introduction to trigger points with myself, Joseph Devlin. I want to have a little chat about these images here. These images were results of a study that was done by Janet Travell and David Simons, and they looked at a big sample size of patients who came through with pain. And they were looking in particular about trigger points and what patterns trigger points had in their pain. So you can see that there is a number of regions broken down here on this poster, which is a very popular one. You see it in a lot of physical therapy clinics. There's an upper body one and a lower body one. You can see here the quality isn't that good, sorry, but it's part 2 of 1. And in Zoom, you can see here that there is a pattern around pain that came in with these patients that were sampled. And what you're seeing here is you're seeing the X's, and you see some of them are in black, some of them here over the red are in white. And what they link to is they link to a trigger point, that's X, X marks the spot, and then you see where the pain was referred from that trigger point. So when the therapist pressed onto the trigger point, or the myofascial pain was being referred from that trigger point, this was the pattern of their pain. And these posters are very, very popular and very powerful. And I've actually had clients come and see the poster for the first time and have an aha moment and really kind of go, I see now, this is my pain. Or sometimes they're actually in for treatment on a different area and they're just gazing at these posters and they'll actually be kind of like, oh, that's my pain from a different area, which actually they've been experiencing for a long time. So these posters are pretty cool, and I wanted to let you guys have a look at them and explain a little bit about the pattern which is there, because I see this over and over and over again in clients. And this one here is quite a good one here. We're looking at glute min, because you can see underneath, and I'm sorry it's a bit blurry, I couldn't get a better quality one, but this here is your anatomical drawing underneath. Here you see the lumbar spine, and you see the femur here and the pelvis, and that is your glute min underneath. And you can see there by the pain referral that it's actually all the way down the leg potentially. And this is a super popular one I get with clients all the time. I press in here and they say, oh, that's going all the way down to my ankle or my foot. So this also is interesting because this is sometimes potentially misdiagnosed as sciatic pain. People say I have sciatica because the pain is going down the leg. And they may have that. They may have a disc protrusion, or they may have an occlusion of the sciatic nerve. That absolutely may be true, but this is a real common misnomer where sometimes this myofascial pain can be misdiagnosed or misinterpreted. And in the age of Dr. Google and people maybe not going to therapists or not going to practitioners to get diagnosed, then sometimes they can jump to assumptions, or someone can tell them, oh, you've got sciatica.